So the day has come. I am making the video about Saxenda versus Ozempic. So where to begin? I guess let's start with the obvious. Saxenda is a daily injection, subcutaneous injection, and Ozempic is a weekly subcutaneous injection. The other big difference is that Saxenda is a totally different drug. It's liraglutide, and Ozempic is semaglutide. So Health Canada has provided Saxenda with the indication on the product monograph for chronic weight management, whereas for Ozempic or semaglutide going up to 2 milligrams, it is to be used for diabetic patients only. So over the past couple of years, we have all around the world seen a big uptake in medications, specifically GLP-1 receptor agonists, which Ozempic and Saxenda belong to, be used for weight management. Now, because of the shortages going on, a lot more Saxenda is now being used appropriately for weight management, but patients and physicians are still using Ozempic for that reason. So I want to talk to you about Saxenda versus Ozempic from a doctor's point of view, practicing in Canada, and why I think Saxenda is the better drug to use for weight management. So number one, it is approved, Health Canada approved for chronic weight management, whereas Ozempic is approved for diabetes management. And when we deal with these medications to begin with, they're very, very expensive, and we're going to keep cash paying aside. But patients that are using these medications that have supplemental insurance, the insurance company really wants you to obviously have diabetes if you're using Ozempic. Patients that have an indication for chronic weight management medications will be able to use Saxenda. It will be approved for those patients that it would have been approved for anyways. So that's one of the major reasons why I think that Saxenda is probably a better option if you have weight management that you're targeting. Another big reason why I think Saxenda is better is because that the 3 milligram max dose of Saxenda is actually more comparable to the 2.4 milligrams of the semaglutide that's available in the US. I don't know if it's available, but that's approved in the US for weight management. It is also approved in Canada for weight management. So I guess what I'm saying is when we're using Ozempic at the 1 milligram dosage or at the 2.0 milligram dosage, it's not quite as effective, in my opinion, for most patients as Saxenda would be at the 3 milligram dosage. Now, one of the drawbacks, I guess, that could be said about Saxenda is that Saxenda is a daily injection versus Ozempic, which is a weekly injection. Now, for most people, it's not a major issue. One of the, I guess, possible side effects of injection medications is site irritation. So irritation at which point patients are injecting. So that's a possibility. Obviously, it's not very common, but it is a possibility. When it comes to, again, Saxenda versus Ozempic, I think another big factor to look at is just the landscape right now. Saxenda, I guess for a very short period of time, it's January 2024. There is a little bit of a shortage issue, but not as much as the Ozempic shortage issue. So there was a good 2 months, I guess 2-3 months of some shortages, partly because of the popularity of the medication Ozempic and maybe some off-label use as well. So I think right now it's still true that Saxenda is a lot easier to get versus Ozempic, especially for weight management. So overall, I just want to summarize. I think if you're looking to lose weight and pharmacotherapy has been decided to be a good option by both you and your physician, your provider, I think Saxenda is the superior option in today's landscape when compared to Ozempic. Thanks for watching.